bioprinting offers certainly a big hope for medical field, especially for organ and viable tissue replacements. And it was postulated that we can certainly in the near future to replace a kidney for patients on the dialysis. For example, in Belgium, so the waiting list to receive a kidney, it represents 800 days before to have human organs from human donors. Therefore, you can estimate the potential in clinics of bioprinting to replace by tissue engineering. But unfortunately, the way is not so simple. And the cells certainly constitute one of the most smallest functional units in the human body, which is well organized in three-dimensional structure with specific orientations for a functionality and for a metabolic activities. Therefore, the aim of the bioprinting in medical practice is certainly to combine the scaffold with specific orientations and the cell seedings in view to perform regenerative medicines and to replace the organ failure or tissue failure in this case. The regenerative medicines fields include several types of discipline implied in the bioprinting for replacements of organ or tissue in clinical practice. We have especially the tissue engineering and the cell therapies, including the materials, the cell transplantations, and the growth release of factors. Already now on the markets of regenerative medicine, the therapeutic companies and the cell tissue banking are main actors in the field of medical therapy for organ and tissue replacement, essentially in the tissue engineering and the cell therapy activities. When we look in the cell therapy as well as in the case of tissue engineering field, we can show that the muscular skeletal tissue remains certainly one of the most important tissue which could be replaced and could be main factors in view to bioprinting replacements for the tissue, as well as the wound healing in this case of chronic skin problems in patients after burning or with diabetes, for example. And in the case of tissue engineering, you can also more than 30% of already available therapies, as well as in case of the ongoing preclinical and clinical studies, are mainly focused on musculoskeletal transplantation and replacement, as well as in bone and cartilage filling. But however, it's important to keep in mind to replace an organ and tissue to have a balance between, it's often totally forget by the developers of bioprinting, is the balance between the bioimplants for the properties in terms of functionality, cellular viability, proof of concept in preclinical studies to be matched with the host and tissue organ requirement to replace the failure in terms of anatomy, physiology, but also cellular engraftment to have a good organ replacement or tissue replacement. I would like to take an example because the bones is certainly an easy way and it's the most important market because it's very, very theoretically a simple tissue to be replaced. But if we look at bone non-union, non-consolidations after fractures, it's like a desert. And you have a new articulations, it's characterized by pain, and you have no vessels and no cells to replace the bones. Therefore, it's postulated to replace by a tissue mimicking the recruitment and the normal physiology of bone consolidation characterized by recruitment of cells, proliferations of stem cells, and differentiations into a new bone tissue with a specific architecture of the bones requiring for making mechanical strength. But in tissue engineering, and also especially in 3D printing, is often forget the pathophysiology of the disease with different type of problems in the healing process and the physiological healing process of the tissue from the hematoma, from the regenerations of the tissue. And currently, since there is three main properties required for a new bones formations, I don't go inside the specification, but we have three main characteristics. Only the native autologous bone tissue from your body have all properties required for bone replacements. If you see all the substitute relatively well-known currently on the market to replace a bones, any offers all properties required for bone regenerations. And there is more than 30 years ago that a lot of industry works on the replacement of bone tissue. The autologous bone tissue of your body remains the gold standard for bone tissue replacement. And therefore, it's important to keep in mind that the architecture of the bones, the physiology of the bones replacement is very complex materials for simple structures. For bone, as well as in case of organ transplantation, it's important to keep the biological principles required for the new replacement of the tissue, from the cells up to the tissue regenerations, including different growth factors, replacement and remodeling of the tissue, and so on. And you can see an examples for bone replacement by 3D bioprinting, including materials, growth factor release for recruitment of stem cells in view to remodel and to produce a new tissue replacement and new bones. It's things to be simple, it is very complex pathophysiological mechanism. If you can see in the literature, there is a significant increase of paper and manuscript reporting bone tissue engineering in the field of cells, matrix, and other, and now there is no clinical alternatives to be proposed in view to replace a large bone defect in contrast to a bone tissue allograft from a human donors. The classical way remains the human tissue and no alternative currently into the clinics. Because there is no good understanding of the algorithm in view to, for bones, but also for other organs, is to interpret and to have a good preclinical models in animals to prove the relevance of your therapies in view to demonstrate the proof of concept to go to the clinics in terms of scaffold, in terms of cell transplantations, in terms of growth factor release, in view to be in correlations with the healing physiology of your tissue, of your organs. But however, following the regulations about advanced therapy of medicinal products in Europe implemented in different countries of the EU, the significant higher costs associated to the safety of the production and the manufacturing of a bioprinting materials is significantly higher than in the simple classical techniques in clinics. And now we must demonstrate the clinical relevance not only for the patients, but also for the medical health system in terms of cost for the patients. Thank you very much for your attention.